Hello, I welcome you back to my platform and I wish you and your loved ones a happy new year. Thank you so much for the support that you accorded me last year. Thank you so much for liking, sharing, watching, commenting on my videos. Thank you so much for subscribing to my platform.
This is the part 2 of surgical site infection, and it is about the prevention of surgical site infection. Those precautions that we can put in place to ensure that we reduce the risk of surgical site infections in our patients. Successful prevention of surgical site infection requires a concerted effort of the health workers, the patients, and the caregivers of the patients. But before I can start highlighting the different precautions that we can put in place to avoid surgical site infection, I want to emphasize something about surgical site infection. The germs that actually cause surgical site infection can come from outside the body or from inside the body, especially if the organs were opened. For example, in the context of appendicectomy, where the appendix has been removed. The other instance can be that maybe the patient had a hole on the intestine or on the stomach, and then the contents of the intestines or the stomach contaminated the abdominal cavity, and as we make an incision, the fluid within the abdominal cavity can contaminate the incision, the different layers of the abdomen. So we can either have an introduction of the bacteria into the different layers of the body from outside the body, or the bacteria can come from inside the body. The following are the precautions that we can put in place in order to reduce the risk of surgical site infection. The risk factors, for example, diabetes mellitus, hypertension, foreign bodies, hematomas, patients that are obese, patients that have malnutrition. These patients have to first be optimized. What I mean by optimization is these conditions have to be first addressed, because if they are not addressed, the patient has a higher risk of surgical site infection. So you have to work hand in hand with your doctors, with your surgeons, in order to make sure that these conditions are under control before surgery, especially for elective cases.
And for all patients that are undergoing surgeries, especially for the elective surgeries, please make sure that the blood sugar levels for all patients before surgery, during surgery, and after surgery, it should not exceed 11.1 millimoles per liter. If it is more than 11.1 millimoles per liter, it can predispose the patient to surgical site infection. And for all diabetic patients, the HbA1c should be less than 8%. So it is very important that you take the measurements of the HbA1c before surgery, because if it is more than that, it can set them up for a higher risk of surgical site infection. For patients that smoke, it is advisable that they quit smoking at least 6 weeks before surgery. Even after surgery, it is advisable that they shouldn't smoke for at least 4 weeks after surgery. This is because smoking has a way of reducing blood flow to the operative site. And if this happens, there is also a reduction in the flow and recruitment of the cells of the immune system that are responsible for fighting infection that might have set in the wound. Multiple nutrient enhanced nutritional formulas can also be employed, especially in patients that are malnourished and are probably undergoing cardiovascular surgeries or cancer surgeries. So it is important that we utilize these formulas for these patients that are malnourished. And for all patients that are undergoing surgeries, for example, on the colon and the rectum by the way, is the part of the intestine where stool is stored before it is passed out. So for all patients that are undergoing those surgeries on those areas, it is advisable that you work hand in hand with your doctors, with your surgeons, to undergo a bowel preparation, a mechanical bowel preparation. And also you are advised to take oral antibiotics. A mechanical bowel preparation is when you're given a solution to take via mouth, and it can help you to clear the stool from your intestines. This can help the stool not to contaminate the operative site and also your abdominal cavity during surgery. Before surgery, the patient is advised to take a shower, and this can be done with an antimicrobial soap or a non-antimicrobial soap. That is the soap that can kill the germs or the one that doesn't have the properties of killing the germs. Either way, the patient has a better outcome as far as reducing surgical site infection. Please also avoid hypothermia. Hypothermia is when the body temperature is below 35. So it is very important that the health workers, the patients, and the patient's attendant keep the patient's body warm before surgery and after surgery. And of course, for the health workers, they should maintain the patient's temperature within normal ranges during surgery. We always use some devices that can generate heat, and in some settings that don't have the devices, we can improvise with cotton. But it is really important that we keep the patient's temperatures within the normal ranges. Never allow the patient's temperature to drop below 35 degrees Celsius, as this can predispose the patient to surgical site infection. Still, for the health workers, please always remember to give prophylactic antibiotics for all surgeries. Especially, it should be given within 1 hour before an incision, a cut is made, especially for all antibiotics. But for the fluoroquinolones and then the vancomycin, you can give within 2 hours before the incision is made. We can also employ an alcohol-based hand rub, or we can scrub our hands with an antiseptic soap. But just in case we are not so sure about the quality of the water, because sometimes the water sources are not that reliable, we should always just stick to the alcohol-based hand rub. And even when it comes to the preparation of the patient's skin, it is best that we use an alcohol-based antiseptic agent. And for centers that can afford sutures that are coated with triclosan, please buy those sutures. Triclosan is an antiseptic that is coated on the sutures. It has also shown to reduce the risk of surgical site infection. Still, for the health workers, please avoid putting any antiseptic agents, for example, on a gauze and then you put on the wound after surgery. As long as the wound has been cleaned, you don't have to put any other thing like maybe antiseptic, ointments, powders. There is no need, as that has shown not to have any effect as far as preventing surgical site infection. So what you have to do is, after surgery, you have cleaned the wound nicely with antiseptic and it is now dry. Just put a dry gauze. You don't have to put povidone iodine on the wounds, and wounds heal better when they are dry. This next point has been realized from my experience as a surgeon. Usually when the patient's wound is left closed, like with the dressing on, for at least 1 month, they have less risk of surgical site infection. And I really want you to adopt this for yourselves and for your patients. So please always leave the dressing on after stitch removal until like after a month after surgery, because at this point, before the 1 month, the tensile strength of the wound is less, so the wound is weak, and so it can easily have an inoculation of the germs, and then the patients can end up with surgical site infection. So please exercise occlusive dressing for your patients. Always use sterile gauze to dress your patient's wounds. This is because the infection can come from outside the body, and these patients sometimes they can touch the wounds with their hands accidentally, and then they can inoculate germs into the wound. But if the wound is closed, at least they don't inoculate these germs into the wound. So please, to emphasize, please exercise occlusive dressing for your wounds, and this should be done for up to a month after surgery. It has shown in my experience good outcomes. The patients, the healthcare professionals, and their caregivers are always advised to wear gloves, especially when taking care of the patient's wound. Please always wear gloves, most preferably the surgical gloves, because they are sterile. This means that we should always refrain from touching the wound, the operative site, with our bare hands. The patients, the caregivers, and the healthcare professionals should always wash their hands after caring for the patient's wounds. This can prevent transfer of germs from one patient to another. So it is very, very important that we exercise very good hand hygiene. And for visitors that come in to visit the patients, please always make sure that you wash your hands, or you rub your hands with an alcohol-based hand rub. And this should be done before visiting the patient and after visiting the patient, such that you don't come with any bacteria or any germs and contaminate the patient, or you don't leave the hospital setting, or you don't leave the area where the patient has been with a germ and then you take it home with you. It is very important that we exercise good hand hygiene. Please also make sure that your environment is clean, because if you have a dirty environment around you, you can easily touch dirty surfaces and then you can accidentally touch your wounds. Please be on the lookout for the early warning signs of surgical site infection. For example, pain, fevers, swelling, pus discharging out of the surgical site, as this can help us mitigate the surgical site infection before it progresses. So that is all that I had prepared for you about surgical site infections. Thank you so much for listening to me. Please share my videos, share them with your loved ones, and please subscribe. See you in my next video. Bye.